My name's Patrick Grover. I'm a consultant neurosurgeon at Queen Square Hospital in London. I decided to become a doctor because actually I was initially a scientist, and I did a degree in biological sciences and neurosciences, and I became very interested in research, and particularly applied research and medical research. And I realized over that time that my actual interest was in science applied to helping patients or helping advance medicine. But during the course of that realization, I then understood that I should apply for medicine so that I could realize my interests. And then having done that as a graduate, I very much enjoyed that. I enjoyed going to hospitals, seeing patients, and formulating plans, and then I developed my interest subsequent to that in surgery. So I had done a master's in neurosciences, and during the course of my medical degree, I was doing research, particularly in deep brain stimulation and stereotactic surgery. And I think with my science background, my academic interest was certainly in the neurological sciences. I then did attachments in neurosurgery, and I simply found it fascinating and also extremely rewarding. I think the neurosurgery gives you the opportunity in many different subspecialties to do something which is technically very demanding, and also, if done well, extremely rewarding, with sort of the great opportunity to help patients and make improvements on a daily basis. So I think really it was the challenge of neurosurgery, the spectrum of patients, and just that kind of interest that spurred me on, really. I grew up in London, so I haven't moved very far. I went to school in North London, and I did my medical training in Oxford University. I did all the sort of before medicine and also medicine itself in Oxford, and then I came back to London for my higher surgical training and have stayed here ever since. Well, the great challenge, I think, of most of neurosurgery is dealing with complications and avoiding complications, and accepting that unfortunately a small percentage of patients will always have complications or come to harm if you do something which has high stakes. So my specialties are vascular neurosurgery and skull-based neurosurgery. So I treat a lot of aneurysms, I do a lot of emergency work, and I do a lot of brain tumors in difficult locations of the brain. And there is a percentage risk, unfortunately, that things will go wrong. And for the patient, obviously, potentially that could be a catastrophe or could really affect their future. It's often very difficult for families to come to terms with. And as a physician, you also have to come to terms with it and minimize the risk of things going wrong as much as possible every time you go to work. Well, I think leading on from that, I think you should always do the safest thing that you can do. Broadly speaking, if you're doing something safely, you're probably doing something well and for the benefit of the patient at the same time. You obviously can't be overly cautious, because there is a risk that you do not take on patients or operations because you're risk averse. But I think the first principle of do no harm for most people and most patients is actually the primary principle.